Hi, everyone. I'm Michelle Jobin, and you are listening to Time to Talk, a podcast for caregivers. This podcast is dedicated to helping family caregivers in Ontario. Through expert tips and resources, you will gain knowledge and validation for the ups and downs that come with caregiving. More importantly, you'll learn that you're not alone. It's so important to take this time for yourself. We're glad you're here. Today, we're joined by Tatum Wilson, the CEO of Children's Mental Health Ontario, and Vicki Cochrane, the Family Partnership Program Manager for Children's Mental Health Ontario. Tatum has over 20 years of experience in multiple health and social policy environments, including government, academic health, science centers, and advocacy organizations. He has played leadership roles in various sectors, including healthcare, child welfare, and youth engagement and empowerment. He is a passionate advocate for equity and is a proud dad of an amazing 5-year-old son. Vicki has been supporting families for over 20 years as well and is a former guest on this show and currently manages the provincial program at CMHO, Parents for Children's Mental Health, or PCMH. PCMH supports families across Ontario through peer support chapters for parents and caregivers, ongoing webinars, and the virtual family care center, available at family.cmho.org. Vicki is also a parent and caregiver with lived expertise, having 2 sons with varying mental health exceptions who required constant advocacy and support. Tatum and Vicki, thank you so much for joining us today.
Thanks so much, Michelle. It's great to be here, and we really appreciate your attention to these important issues.
And thanks for having me back. This is a topic close to my heart, and I'm happy to talk more about it today. So thank you.
Oh, it's our pleasure. And Vicki, I know that our episode with you from last season really resonated with our listeners so much. So it's a joy to speak to you again and to have Tatum on the show. And this is such an important topic to so many people. And I was telling Vicki earlier, it's definitely something that has been top of mind in my household, especially as we are going back to school. I have a 10-year-old son, and this is a really important topic. So I did want to just dive right in and make sure that we have this conversation that helps our listeners, the parents and caregivers that are out there that are thinking about these issues right now, caring for a child that has mental health concern, really feel that they are seen and heard, and maybe we can give them some tools to move forward with. So let's talk about back to school and the whole mental health landscape that is associated with this time of year. Back to school can be exciting, of course, but it can also be incredibly stressful. And that's just sort of in normal circumstances, right? So, from your perspectives, what are families and caregivers experiencing most at that back to school time?
You're absolutely right. I mean, there's a lot of mixed emotions and experiences for sure. For some families, they're so happy to have a return back to some much needed structure and the support that's offered through schools for their children and youth. And so with that sometimes brings excitement and possibility, but also there's families where it brings other challenges, right? And it's actually filled with anxiety, or it's a challenge to return back to routines because transitions are hard. So, some families are going into this season of back to school feeling less secure about what's to come.
I would just add to that as well. As mentioned earlier, that I am the dad of a 5-year-old son who just started grade 1, and we are very fortunate. He seems to like school. He enjoys going, but even that transition into a new grade, new types of learning, a new teacher, his daycare also changed. It just brings with it a lot of feelings, both for the parents of your own anxiety, but then also trying to figure out in an age appropriate way what some of the challenges are that the kid is facing. And I know for us, again, like I said, our son seems to enjoy school, but that also requires a lot of prep, a lot of sort of talking about things ahead of time. And so, it's the full range of things, as with any transition, as any change from one state to another. And I think, from my perspective, seeing it through the eyes of a kid who's in grade 1 is one view, but we know that these kind of things, are for kids throughout all ages, whether it's a new school, a new neighborhood, just a new grade, whatever it is. So it brings a lot of different things and for the families and for the kids specifically.
And we certainly had conversations in my house as well about feelings of anxiety. It's definitely something that I know at all stages, like you mentioned, a lot of parents and children and caregivers do experience. I wanted to ask Tatum, from a system-wide view, what mental health challenges are schools and community organizations seeing more often at this point, at the back to school time?
Yeah. I mean, it's interesting you raise the system-wide view because, and particularly the connection between schools and community organizations. And one thing I would say is that just generally, both sectors, as it relates to kids' mental health and their well-being, are kind of under-resourced as it is. We've had a lot of new investments, which have been welcome, but there is still a lot of areas where we need more investments if they are able to best support kids and students so that they can get faster access to both assessments and then to the care that they need once they have the results of those assessments, both in the school and in the community. Another important thing is just the relationship between community and schools. In some places, in some parts of the province, it works really, really well. There's good communication, there's great collaboration, good partnerships have been built to support the students who are, maybe having an issue identified in the school and then be able to transition into support in the community or vice versa. And then, but there are other parts of the province where it's not as seamless. And so, one of the things that we're working on at CMHO is implementation of a report that was written called Right Time, Right Care, which is really about getting kids access to the right care at the right time. And so this is something that's being implemented, and it's really being able to build the bridge between schools and communities so that when kids do present with issues in either location, they are able to get the resources that they need in the most appropriate place. More specifically about students and as they return to class, it's really what Vicki described above. Some things about the structure and the routine are really important and helpful. And for other kids, just the idea of going to school is a challenge. And so we do also know that there are still lingering impacts from the pandemic. And many of the public health measures, while well-intentioned and of course appropriate, really had a kind of disproportionate impact on kids because their regular routines were disrupted, their access to school and friends were disrupted, and then even just social distancing with friends and family and the typical support. So that also means that for a whole cohort of kids, there are ways in which school is not necessarily the place that it had been before because there had been such an interruption in that normal, typical relationship as it would have emerged. And so just now, as we know, some kids have a sort of fractured relationship with school because of that, or just interrupted, or even in some cases, non-existent. So, all of the issues that we know may have affected kids as they went back to school are sort of further exacerbated because the relationship with school in that setting is a little bit different. So, specifically, it is things like, depression, anxiety, resistance to school attendance, and those kind of things. But again, it's just a bit more nuanced now because we had that sort of 2 to 3 year period where school wasn't what it had been all the time. So that's affecting kids in different ways.
That it makes so much sense. All of the points that you made, and definitely the changes over the last while due to the pandemic. My son turned 5 in March of 2020.
Yeah.
So an entirely different experience than perhaps your son, who is 5 now, would have had, and just sort of those effects. But I think you mentioned this point about access and the ability to access care when needed. And I think that is something I think about often. And then the other thing is when we have a child that is experiencing difficulties and that needs care, that point where parents, caregivers, teachers sort of struggle with is this just sort of a normal part of going to school and going through these changes and going through the different stages of childhood and adolescence? Or when do we sort of identify this as being a problem or a challenge or something that needs to be addressed for the welfare of that child and also the caregivers going forward? So I think I want to ask at this point, why is it so important for caregivers to have the support and resources early rather than waiting until that challenge escalates? And at what point, how do we identify when we've escalated from something that is sort of a typical situation to something that is perhaps something that needs a little bit more addressing as a concern?
I think that's a great question and probably one that will help a lot of families hopefully figure this out, because one thing we do know from research is that early intervention is really key to better health and social outcomes for kids as they, move into becoming independent adults, right? They sort of need these supports. And when you're building, you're sort of in a crisis, building your support network is really key. And knowing where to go for resources can be tough to figure out when your family is in crisis or you are worried and you're not really sure, like you mentioned, is this typical or should I be getting some help? And so I think it's really about being proactive. So as parents and caregivers, we know our kids best. We have to trust our guts. And when you start to worry or wonder and you're kind of wondering, is this normal? I think that's the point to actually reach out for some help to professionals who know the difference, even if it means just a conversation on an intake line where you explain the problem and the challenge. They'll be able to help you figure that out. So reaching out to your community child and youth mental health service providers or connecting with our peer support program, PCMH. Our volunteer parents and caregivers are trained to help families connect with services that are local to them. And we also have a find help tool on our webpage where you can actually search up where are your local child and youth mental health tools. So I would suggest that if you're a parent and you're listening to this and you are worried and you're wondering, is this typical? It's maybe time to reach out because you know your kids best. And I would also suggest that maybe if something has escalated once, it's time to be prepared for that possible next time. I remember with my son, I was dealing with some challenges at home when he was in grade 1 and 2. And I thought, I don't know if everybody's dealing with this. And I'm a trained professional. And I still kind of questioned, maybe this is normal, but then when the school started mentioning concerns, that was the clue for me to kind of reach out and get some professional help. So I did that through our local community child and youth mental health service provider. I connected with my family doctor, and that's how I got the ball rolling to sort of help me tease that out. Because even as someone trained in child development, I was still wondering, and my gut told me something's not right. And I didn't necessarily know what wasn't right, but reaching out for help helps you figure that out so you're not alone in that process.
And then I guess the earlier you do so, if there is something that does need to be addressed, the better, because then you have those tools earlier.
Absolutely. But I would also say as a parent, if it's been a while, it's never too late. So early intervention we know is key, but I would say any intervention can be helpful at any point in time. So to reach out for help when you've got that feeling that something's not right.
Caregivers in Ontario provide an average of between 11 to 30 hours of care per week, supporting a family member, partner, friend, or neighbor. But what happens when the caregiver is unavailable or an emergency arises that affects their care duties? With burnout at an all-time high, caregivers need their own support networks and a contingency plan for the person they care for. Our contingency and emergency planning toolkits can help you plan ahead and give you peace of mind for the future. For resources like these and more, visit ontariocaregiver.ca. Now, back to our episode. Are there particular signs that caregivers should watch for in their children that might indicate that back to school stress is a larger concern?
Yeah, great question. We hear this a lot from parents is how do I know, when I should reach out for help? And so generally what clinicians share with us is that you really want to take notice when your child or youth's behavior changes and sort of does catch your attention. So for example, changes in appetite. Maybe they don't seem to be interested in those family meals. Maybe there's changes in their social behavior, or they're eating more, right? Maybe they're becoming more withdrawn when they're usually a social kid. Maybe they're coming home and going right to their room instead of chatting with you like they usually do. Some kids have like an increase in physical symptoms, but they're not really sick because they don't have a fever, or they're not having other challenges, or they can do one thing, but they can't do another, even though they've said they can't go to school because their stomach hurts, but they're running outside to play. Right. So, I mean, these are some of the things that we notice. If they suddenly are wanting to come home from school on a regular basis or early, or maybe they're not wanting to go to school at all. I know my younger son really struggled in high school, and he was a pretty social kid, pretty sort of resilient. He'd get up and just keep on going, but he could not get out of bed. and he'd get out of bed for work, he'd get out of bed for social activities, but he could not get out of bed on time for school. And so, I got in touch with professionals and ruled out physical things. We did a sleep study. We, talked with our doctor about mental health care and checking in with him on that end. And as it turned out, it really was just related to school. And so then I had to reach out to the school and try to work on a plan to support him, because that wasn't typical for him. So I say to parents, you know your kid best. As soon as you feel like something's off, it's time to check in with professionals.
It's also interesting for me, again, as a parent of a young kiddo, is that he's experiencing a lot of firsts, and we're trying to figure out sort of what is normal. And the thing that I would just remind people is that we you part of what is looking out for possible signs is also not to quickly jump to conclusions. For me, both in our own experience, but also as sort of best practice, is creating an atmosphere of openness and communication with the kid, with their teachers, with administrators at the school. And there are so many factors that can impact a child in the school setting, that maybe they're just not getting enough sleep, as Vicki said, she had explored as a possible challenge. Maybe there's conflict with friends or challenges with new learning and new concepts. And so I think that for me, and just in best practice, the one of the most important things you can do is just open those lines of communication before seeing a problem. And that's a really important element. And it's also helpful to know sort of like, what is the baseline, like what is kind of standard, so that you all have a sense of what that is. And then when you see sort of deviations from that, then you are able to then better explore the things that Vicki had already said. But you don't want to only go to the teacher or the parent when you think there's a problem, or sorry, the teacher or the administrator when you think there's a problem. You want to create a relationship so that the trust is built, and then you can collaborate together if and when you start to see that things are a bit different. And so, yeah, I just think that's an important thing to add, is to not jump to conclusions, but not be afraid to acknowledge the reality of the range of possibilities.
That is great advice from both of you. And I have to say, one of the things that I love about the work that both of you do is that you provide resources for parents. And that's, I think, so important, especially for those of us that might be up searching for answers in the middle of the night when things are on our mind, or things like that, or not in the middle of the night for that matter. So I wanted to talk about the resources that you have available through the work that you do, and specifically the school mental health backpack, which is a trusted tool for families. There is an updated version this year. So can you tell us more about that, and why resources like the backpack are so important for not only parents, but also schools and as well?
Yeah, no, great question. And I appreciate the whole searching in the middle of the night, because I do think that's a real experience for some folks. So,
Certainly me.
Google is busy, I think. And, we've looked to update our backpack this year by adding a high school section, because we heard from families that they wanted more information to support their youth, right? There were a lot of things that were more sort of elementary school focused. And so we've now kind of really distinguished the difference. So we've expanded that resource in ways that include the school avoidance toolkit that we used to have. We've actually changed that to be called School Attendance Challenges. Families found that resource really helpful, but they wanted it to dig deeper. It was our top visited resource within the school mental health backpack. So we worked with clinicians because we felt it was important to validate the parent and caregiver's experience with that. And it's really isolating being a family that has a kiddo struggling to get to school. Hard to talk about it when everyone else seems to be talking about how well their kid's doing, the awards they're winning at school, the sports they're involved in, or the activities that they're involved in. It's really hard to jump into that conversation and be like, well, my kid's not even getting out of bed, and I don't even know what to do next. And so our resources, including the school mental health backpack, feel like a trusted friend that has great advice and helps you to feel less alone. There's a lot of families struggling with this out there, and that's why resources like this are important to schools as well, because it illustrates the complexities of the challenges that families are facing. It's often not a parenting problem, and I think people are quick to jump to that, which continues to sort of enhance the stigma of parent blame and shame. Parents and caregivers need compassion and support to best support their kids. And so hopefully schools can also use these resources to share them with families when they see the struggles happening, and better understand the complexities within that, because schools are the first to be a support to families in that moment, or to notice and kind of open the conversation with families. And so we hope that this resource can help on both sides for families and educators.
For the high school mental health backpack, are there any other updates this year that you can highlight for us?
Absolutely. So the backpack itself has always been developed in partnership with clinicians.
Mhm.
And this year in particular, we also added a CMHO Family Partnership Council, who are families with lived experience that are supporting their kids with mental health challenges. So this high school section was written to include parent-to-parent tips, because we always hear from families that they want to hear from other parents and caregivers too. So the topics in this section include school attendance challenges, supporting your kid through transition to high school, right? Youth need support too, even though they want to do it on their own. They're sort of at that stage of needing a bit of balance. And then healthy digital habits. That's a big
Mhm.
concern for this generation of parents.
Absolutely.
How to communicate with your youth is actually another resource that we've always heard from parents, like, how do I even have this conversation? How do I start? What do I say when this happens? So we've built in some resources that can be used, not just related to school, but just in general. And then how to communicate with the school, because that is your number one place to build a relationship, is at the school. So we hope that these resources help parents and caregivers understand the needs of their youth a little better, because this generation, as I said, is experiencing things that our generation as parents did not. So we've heard from youth, for example, stop comparing generations and telling me how to respond like you did. So it's important for parents and caregivers to hear what their youth are saying and work with them, to be a team to solve the challenges they're faced with.
That makes a lot of sense. Those updates are very necessary, I'm sure. And I can attest to the fact that especially those digital components are such a tricky piece that parents and caregivers are dealing with now. When it
Mhm.
comes to the updated understanding and managing school attendance challenges resources, can you tell us a little bit more about that and how caregivers might use that in real life?
Absolutely. We worked with a clinician from the Canadian School Attendance Partnership, who has researched this important topic and engaged again with our Family Partnership Council to bring their lived experience. So, this resource is intended to help parents and caregivers better understand the issue of their child or youth not going to school, because it isn't because of something that they have or haven't done as a parent, or even the child or youth themselves. Sometimes, people make comments about how kids are lazy, they're just not getting up and going, and that's really not true. It's more complex than that. And the resource talks about all of the things to consider and take into account. So typically, if a kiddo's not going to school, no matter what age, it's an indication that there's something else going on and that support is needed. So this resource walks families through things to consider, such as possible causes, ways to communicate with your child or youth to open that conversation in a way that'll sort of help be supportive in that moment, and then how to build your support network as a family. But it also highlights the importance of finding a supportive connection at the school, because making the school a part of the team and solving the problem is really key. They have resources at their fingertips that families don't always know about. And so it's really important to start that conversation. And even in high school, helping to coach your youth in how to start that conversation and figure out who they feel most connected to at school. So ultimately, what's important is to focus on getting kids back to school, even if it's in baby steps, because we know from the research that attending school regularly helps kids learn, build friendships, develop socially and emotionally at all ages, even in high school. So, for example, showing up consistently in high school is linked to youth staying on track and graduating and opening up opportunities for the future. So we have real life steps in this resource that can be taken to address the challenges, and provide multiple resources throughout it that will connect parents and caregivers to other resources within that.
Are there any examples that you might have of how a family has successfully used the backpack resource?
Absolutely. I think back to an email that I got from a father who reached out sharing, you know what, I've followed all the advice in the resource and still nothing's working. And this was back with our school avoidance resource.
Mm.
And this is sort of partly what triggered, hearing from families, okay, I've done this, I've done that, now what? And so we needed to dig a bit deeper. And so with that family, for example, we helped them connect to a chapter of peer support at PCMH. That person, our peer supporter, then helped navigate that family through how to connect with community child and youth mental health. And because he reached out to us by email, we were able to connect him with his local child and youth mental health service. But also he felt less alone. You know, we validated the fact that this isn't a him problem, right? This isn't a parent problem. This is something happening to hundreds and thousands of other families in the province and even across Canada. So we often hear families trying to manage this on their own. And in the meantime, they become exhausted and they feel like a failure. So once you join a community of peer support, you begin to realize just how many other families are actually going through this. And we've heard from like this father and other families that once they have that feeling, they feel like they can cope better as a parent or caregiver. When they feel connected and like they're not alone, they can figure out a way to find resources or what to do next, or even just connecting with other families. And we hear from them that they don't know what they would have done without the resources, without the peer support groups, and they wish they'd heard of us sooner, because connecting with others who get it helps with just so much, even the little things like day-to-day suggestions.
I think that's so important. We talk about, I just think of it just how we are in general, and many of us are kind of chronically online, and a lot of us see everyone's highlight reels in one way or another all the time of, it's not just our kids, it's our parents too. And we see that. And if we also don't have a network of our own to reach out to where we feel that people understand us, having those peer support groups, there's a ripple effect for the caregiver in terms of
Absolutely.
mental health as well. And it's that whole, you got to put on your own oxygen mask and make sure that you're ready to deal with things so that you can help others. So I really, really do love that story and the result from it as well. Thank you for sharing that. Beyond the backpack, let's talk about supporting families at home and in the community, which is the work that you both do. I, caregivers are navigating so much beyond simply what happens in the classroom for children. So, Vicki, what are other new resources from the Family Care Center that can help them at home? And is there anything you can say that would highlight a couple of those resources, like managing aggression at home or supporting siblings, that you think families would find valuable?
Absolutely. We have been hard at work in this last year. We've added 48 new pages of resources since April. So there is definitely a lot to look at, but I would highlight 6 topics that we were able to focus on during a recent project that was funded by the Ministry of Education. And these resources include information on the topics that I'll share that help families better understand the challenge and what your child or youth also might be experiencing, and then how to also support not only your child or youth, but yourself, and where to turn to for help. So we always sort of make these connections, how to understand it, what to know, what to look for, where to get help, and then also throughout other resources. So we weave in parent-to-parent tips or quick tips from clinicians. And it's really hard to narrow it down to 2 because we have so many topics that we've covered that have been asked for by families. So, for example, we know that eating disorders were on the rise through the pandemic. So we were able to develop an Understanding Body Image, Disordered Eating, and Eating Disorders resource. We have a resource to help folks understand anxiety and how to support their child or youth. We have another resource that we highlighted in June, Understanding Gender, Sexuality, and Expression. So supporting queer and gender diverse children and youth, helping parents to sort of really dive into what are pronouns and why do they matter, for example. But we dug even deeper than that to help folks understand what their youth might be experiencing. And we have so many great resources like that, but I'd like to highlight a couple more specifically that I think stand out. So on managing aggression at home, like you mentioned, we have a resource that was written in partnership with Interwoven Connections, and they are specialists in AFCA, which stands for Aggression Towards Family and Caregivers in Childhood and Adolescence. And I know this intimately because this is something that I dealt with in my own home with my son. Many families are suffering in silence about this. And children or youth are also suffering in silence. And it's like a secret that can't be discussed outside of home. You're just trying to cope. So it has a significant impact, not only on parents and caregivers, but other family members in the home, and then the child and youth themselves. So this resource is intended to validate that experience and shares real tangible things to do to manage that aggression at home. For example, how to prepare a family safety plan, how to support your family in moments of crisis, what to expect if you have to go to the hospital, or even if you think you have to call 911, what to consider in that moment. So, really helping families to turn their minds to planning ahead in crisis. And then you mentioned the siblings. We do have a resource developed called the Sibling Experience. A lot of families don't know how to have these conversations with the other kids in the home. And this resource is full of ways to help understand that dynamic. And we also have a webinar on our website connected to this resource where clinicians talk further about this. And lastly, within the school environment, we hear from families they're dealing with bullying, whether their child is identified as the bully or if they're being targeted by bullying behavior. So we know from our family networks that one of the reasons kids aren't getting to school is as a result of experiencing bullying. It's hard to know what to do and where to start. So including the school in the conversation, and this resource walks you through, how to develop a plan, but also how to engage with your child, whether it is that they're being bullied or engaging in the bullying behavior. So I'm just scratching the surface here, but hopefully this gives you an idea of what, our resources kind of encompass and what's involved in them and how deep we tried to go with them. So the families feel like they really have something they can try and know how to connect with help. But the best part of our trusted resources page is our search function. So you can actually search all of our resources by topic because there's a lot there. And if ever you do need help, you can contact us directly on the webpage and we can help you connect with a resource that might work for you.
The Ontario Caregiver Helpline is your one-stop resource for information about programs and services that can support you in your caregiving role. The helpline is available 24/7 and is answered by our professional community resource specialists in English and French, with interpretation services available in 150 languages upon request. Call 1-833-416-2273. That's 1-833-416-CARE, or use our online live chat to get the support you need. Learn more at ontariocaregiver.ca. And now back to our episode. I feel like the breadth and depth of what you have added just since the last time we talked is really incredible. So I'm very happy to hear that those resources are available for all of the parents and caregivers out there. I did want to put the question to you because I touched on this before about sort of how the caregiver's mental health is also tied up in this health, physical and mental health, really. So Tatum and Vicki, I wanted to ask maybe if you have any advice for caregivers to also protect their own mental health this season.
Yeah, absolutely. I'll start, Tatum, and I'd love to hear from you after, but, really take the time to educate yourself. And so I always say to parents, research things that you're concerned about. And our website, our virtual family care center, is a great place to start. There are trusted resources that have been vetted, that are clinician led, but we also connect you to other reputable services through our website. And so it's a really great place to start with that research. And again, as I've mentioned, build your support network. I can share from my own experience. I have friends and family who were very supportive in my raising of my kids with the challenges I was faced with, but there was still something missing in terms of they didn't have the same lived experience. And so connecting with PCMH when I did back in 2017 really helped my family, and it helped keep my shame and feelings of isolation in check because I wasn't alone. And so talking to trusted family and friends or connecting with our PCMH peer supporters in a group or a one-to-one setting can really help. And lastly, I always say to parents, be kind to yourself. Parenting is hard and reaching out for help is okay. We actually shouldn't be doing this alone. This isn't an easy job.
And I would also add to it, this is an anecdote, but it was really powerful. So back in March, as part of our PCMH program, we had a symposium with a number of the parent volunteers who work and lead the chapters of PCMH. And when we were doing sort of our debrief or our reflections on the time together, one of the parents stood up and said, the idea of being together like this has made me realize, and they used more colorful language, so I'll use the clean version, but they said, we're not just bad parents, right? So much of this experience makes parents reflect on their own sort of parenting and did I do something wrong or make bad choices? And so just to speak again to Vicky's point about being kind to yourself, find a network and those kind of things. PCMH as a program is a great example, but even if it's just locally, reaching out to others, someone else is going through this. And so, that notion again about what you need to remind yourself that this isn't just about your parenting skills, and hearing a parent sort of crystallize that statement so well, just saying, this has made me realize that I'm not just a bad parent, was so powerful. And it was a reminder of what that sort of group approach and sharing your experiences, not letting stigma hold you back from sharing can empower you with. So yeah, I just thought it was a really neat anecdote and it's really stuck with me about the value of these kind of formal and informal parent support networks that exist.
I think that's so important. And it also, I think because so many of us are afraid of being bad parents or caregivers, and the fallout of that is something that is, our fault, or we've caused an issue in some. So it is so helpful. And look, I love the trusted resources you have, and I love the suggestion of also finding that peer group and then the trusted family and friends together, because beyond that, there's a whole lot of advice out there that is probably not from trusted sources and that is on a random group.
And a lot of pressure.
There's a lot of pressure. There's a lot of trying to keep up with one another. And I don't think that's the point. I think that's not creating the village of support that we need. So I love that your suggestions are, those three sort of tandem lanes of support does create the village of support that you need, and to reach out for the resources that you might need. And I love the fact that you said earlier that early intervention is important, but any intervention is important. So it's never too late to start. And I think that takes the pressure off of parents as well, that we, like once we realize that there is something we need to address, we only know what we know when we know it, right? So that's why we have to move forward from that point.
100%.
And if I can just add one other thing, and this is an experience from the school that our son goes to, is people often think of talking to school administrators or teachers for the purposes of talking about their own kid. But one other thing that I've seen at our school is we have an incredibly supportive principal who is making the connections for parents. And particularly with the new kind of technology that we have, where it's not all about having to have sort of what feels like an awkward conversation in the playground at pickup time. Our school has started a WhatsApp group for parents of kids who are identified as neurodivergent or otherwise. And so that has created a virtual, when you're ready to talk about a kind of environment, the principal, if they're talking to a parent and they are hearing these kind of stories, refers them to that group, and then they get added to it. And it has through a technological approach turned into an in-person and very real sort of support group for a whole group of parents at the school. So again, just
amazing.
Think about whoever you're talking to and the other resources that they might have, and we all can be working together to help parents in the ways that we know that we should.
I love that.
Yeah, I love that. I love that on many levels, and I love a technology for good story as well. So that's a really great example, and well done on that administrator as well for having the foresight to do that. If I put this question to both of you, if there is a caregiver listening today and they could take one small action this week to make the transition back to school easier for their child and for themselves, and we can really do this at any time during the year, what would you recommend?
I would say if you're listening today and you're feeling worried about your child or youth, or you're feeling overwhelmed and you're just not sure where to start or what to do, reach out to us at PCMH by sending us a quick email. You can reach us at support@pcmh.ca, and we usually get back to you within a couple of days, and we help you figure out what to do next, because we're here to do exactly that.
And I would say, if it's one thing, remind yourself that you are not alone. If you are experiencing something, it is inevitable that someone else is as well. And talk to a parent in the schoolyard this week, or talk to the administrator, build connections, and do your best. I mean, really, stigma is hard and it's real and it's powerful, but someone else is going through the same thing. And what you might not realize is you're not only helping yourself, but you might be helping out someone else if you reach out to them, because you've opened a door that they may not have known that they've had. So, just keep it up. And I would say, yeah, you're not alone. That's really the most important thing.
Great points from both of you. Thank you so much for that. And Vicki, you did just share that email address, but for our caregivers that want to explore the backpack or other resources, can you remind us where they can go to find them?
Absolutely. So we have a few ways to reach us. Our website is www.family.cmho.org. And on that webpage, you can connect with our trusted resources. You can connect with peer support. Our Parents for Children's Mental Health chapters are across the province of Ontario. We also have the opportunity to connect one-to-one with a peer supporter on there. So I definitely recommend going to our website. You can also follow us on Facebook and Instagram, Parents for Children's Mental Health. And we share our resources on there. We share events that we have coming up, like our webinars. We typically have monthly webinars throughout the school year for families to connect with. And realistically, like I said, you can email us at support@pcmh.ca, and we'll help you connect with whatever you're looking for.
Fantastic. Well, I thank you both so much for being on the podcast today. I have found this very personally very helpful and enlightening. And I know that our listeners, our caregivers that are out there that are looking for resources to help children will certainly find it enlightening as well. So thank you so much for taking the time today.
Thanks for having us.
We hope you enjoyed this episode. You can access more details about support services on our website, ontariocaregiver.ca. Until next time, I'm Michelle Jobin, and you've been listening to Time to Talk, a podcast for caregivers. We hope you have a wonderful day.